Hello, 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 Facebook. I'm Dr. Myla Bennett of Addict Plastic Surgery and Medical Spa in Johns Creek, Georgia. And it's been several days since I came on, and so I figured I would go ahead and come on tonight. Take some questions like I always do, and I have something that I want to talk about. You know, I get a lot of my topics from things that scroll through my timeline. So tonight's topic is compliments of something that came through my timeline on Instagram. So, hello, Janice. Hello, Cherie. Thanks, Janice. So, also, I want to say hi to YouTube because I'm going to upload this video to YouTube. Hey, Ebony. I've been getting a lot of love on YouTube lately. I just kind of started putting old videos on there, and there's some people who like YouTube and they don't do Facebook, and there's some people who like Instagram and don't do Facebook, and but I don't even have very many followers on YouTube, and the people have been very verbal and appreciative of the videos. So I'm actually saying hi to YouTube today because I'm gonna put this one on YouTube as soon as I finish here. And there's a live feature on YouTube too, so I'm gonna soon start going live on YouTube too from my computer probably when I do these, so that way I'll just be recording from two places at once. But for today, it won't be live on YouTube, but I will upload it there as soon as I finish. Hi, Cynthia. Hi, Lisa. Hi, Stephanie. Hi, Brenda. Okay, so here's the deal. So I wanted to talk about plastic surgery addiction. Can you please speak on previous DVT and mommy makeover 80 plastic surgery? Let me write that down so I'll come back to that when I talk about my topic for tonight. DVT in the past with plastic surgery. Okay, that's a good topic. All right. Hello, Michelle. Hello, Chanel. Ladies, please share the video. Let people know I'm on. My goals with these videos is really to keep people safe, help people make really good decisions, safe decisions for themselves. And that's my main motivation in doing these. That's actually what made me start doing these. Was when people would say things and I realized it was like recurring themes of danger, and I just want people to be safe because plastic surgery is becoming more and more popular. Some of the reasons why it's becoming more popular are not good, which is kind of the motivation for my video tonight. And I just want people to be safe. Hi, Stephanie. No, I didn't cut my hair, honey. I just changed my wig. I'm a wig woman. I wear wigs. Every time you see me, it's a wig on my head. I haven't worn my real hair out in years. And before that, I used to wear sew-ins. But now I'm addicted to wigs because I can have a different hairstyle every day. So I got this from the Virgin Hair Fantasy. Yeah, that's a wig, girl. My hair might be long tomorrow, honey. Thank you. So anyway, so what came through my timeline? Yes, so share the video, share. And then, okay, so what came through my timeline actually came through yesterday. Or maybe it was Friday. It was one of these fake Atlanta snow days we've been having. Thank you, Janice. So what came through my timeline, a girl posted something. She has a very active plastic surgery page on Instagram. It's beautifully branded, and she's got a lot of followers and a lot of engagement on her posts. And she posted, if money wasn't an issue, what work would you get done? And the majority of the people on there listed like a million things that they would do to themselves. Like, I would get my boobs, I would get lipo, I would get thigh lift, I would get my nose done, I would get this, I would get that, I would get, a BBL, I would get this. It was like they had like this long laundry list of stuff. And I was just like, whoa, there's not like, it always sends red flags to me when people have like 100 things that they want to modify on themselves. Obviously, I'm not against plastic surgery. That's why I know some of this stuff is confusing to people. And sometimes I'm like, I know when something makes me uncomfortable, but I can't always articulate why. Because I'm like, Myla, you're a plastic surgeon, and I don't think plastic surgery is wrong. But today I had a breakthrough in my own thinking to help me understand and have a firm grasp on what gets under my skin about plastic surgery and why. And it was like a breakthrough. And so I wanted to talk and share. What I realized, what's this stuck on my face? Sorry, y'all. What I realized, when I saw those people putting all those things, like this laundry list of things, like basically ripping themselves apart physically. If you're trying to surgically change 5, 6, 10 things on your body, that's like major, and it's that, in my opinion, for the most part, that's usually an issue on the inside. If you literally like want to change like 7 things, like I want 7 surgeries, like whoa. And I was thinking back to when I was, and people are getting these things younger and younger. So like you'll see girls like in their 20s who haven't had children, who haven't had the stuff that happens to you in life, and aging hasn't shown up on their bodies yet or anything like that. And they'll be like getting these surgeries. And I was thinking back to when I was like a teenager and when I was in my 20s and thinking about me and my friends. And I don't remember us ever really sitting down talking about things that we wanted to change on ourselves physically. I wanted to be a plastic surgeon, but I wasn't thinking about anything that I wanted changed on myself. And it wasn't until I had a child that I actually was like, I guess I'll give me some lipo on my stomach, because I was pretty happy with myself. Like I thought, I had it going on, and I wasn't looking at other people wanting to be like them. And even if I saw another person who I thought had it going on and they had something that I didn't have, I didn't feel like, oh, she got that, I want it. Like I didn't feel like that. And so I think that's the thing that bothers me. I feel like younger and younger, the way the culture is now, and I think social media plays a big part in it, and reality television, I think that we spend so much time comparing ourselves to other people, physically and not physically also, that we start to get consumed with it. And social media, which since we didn't have social media when I was growing up, social media makes it all worse. So you sit and you look at these things and you look at these pictures of other people and you see people changing so quickly and dramatically, and then you see them getting all this attention on social media, and so then people think it can translate over into their lives to be able to, if they can have this thing change, or if their butt was bigger, or if their boobs were bigger, or if their nose was different or whatever, then their lives will be different. And that's not really the case. That's not true. And if it takes you changing everything about yourself physically to get something, my question is, why would you even want that? But that was when I started realizing, I'm like, I think we have to be really conscious of what social media does to us. Like all of us, me included, are very influenced by the things that we see on social media, and it's not all real, and it's not all true, and it's not all good. Just like a lot of these news stories will come through your timeline, and the blog sites that have social media presence, and then they'll put this headline on their page and frame it the way they want to frame it. And if you go outside of their page and research it on your own, a lot of times the story is very, very different. Or sometimes when you read the story, what is said in the title is not at all what happened. And people will take it and run with it. And it's the same thing is happening with plastic surgery, except, thank you, Tanita, except this is something that can kill you. If you get to the point of desperation where you want to change things so bad, and you have a lot of things you want to change. When people have a lot of things they want to change, especially if they're young, because young people tend to have less money than a 40 or 50-year-old lady who wants to change something. They're usually more established and have the disposable income to be able to go and find a place safely to modify things. But younger people, they have less disposable income, if any, and so then they end up in like maybe more unsafe situations trying to bargain shop because it's a whole laundry list of things that they want. This has happened with me in consult with folks a few times, where they have this list and the list is not anything realistic to be done in one setting. And the list, when you add all the stuff up on the list, is a lot of money. It's like, okay, lady, but you have 6 things on this list that you want done, but you want to pay $5,000, and I'm not about to do all that work for $5,000. So then they'll go to a place where they can get it for $5,000, and oftentimes those are places that aren't very safe. So I want, if you have like 4 or 5 things that you want to change about yourself, I want you to stop and say, why am I so unhappy with all these things? Because I'm totally not anti-plastic surgery. I've had it. I had liposuction of my arms when I was in residency. I was a part of a research study. I did my first lipo for research. I was a part of a research study for laser-assisted lipo versus traditional lipo. They did laser on one arm and traditional on the other arm. And guess what? Both arms turned out the same way. It didn't make a difference. And I couldn't tell which one was which because they didn't tell us which one was which. And we just had to report on things for the next 3 months afterwards from a pain, swelling, all that other stuff standpoint. And none of us could guess which arm was which. We basically, it was like 50%, which basically means it was flipping a coin. Nobody could tell which arm was which. That was my first liposuction. I didn't really need it. I mean, I guess I thought my arms was a little fat, but it wasn't really. Can you see my arms? There's my arms. There's my lipo scar. Yep, right there. See, I didn't put no lotion on my elbows, so you just made me show my ashy elbows to everybody who's going to look at this video. But yeah, that was my first liposuction. And then my first plastic surgery procedure. And then my second one was liposuction of my belly, which I got, thanks Tommy, which I got right before I had Bradley, but after Bennett. And I had a little extra flub on my stomach, and I, went and got that taken out. But I wasn't like, I want